Two different pictures are presented in the screen. The one on the left shows an overworked healthcare worker with a pile of papers to be processed using the traditional hospital information system. This leads to frequent transcription error, duplication of records, and longer turnaround times for reports. On the other hand, the right picture shows that a health worker can manage all the works using one device in just one click, ensuring quality outcomes, minimize transcription error, and duplication of records, and shorter turnaround times for report. This is made possible with the help of the modern hospital information system. Great day, everyone. My name is Franz Zeril R. BUSTRIA, together with Shoshana, Angel, Arshan, Jeremy, Zofia, and Kelvin. We will discuss about the hospital information system, its providers in the Philippines, and most importantly, its functions. Here are the following intended learning outcomes. At the end of the lesson, the student should be able to, first, discuss hospital information system, its use in the different departments of the hospital, and the criteria for selection. Moreover, the students will be able to identify the functions of a hospital information system from patient registration to billing. In addition, the students will be able to explain the different reports and summary in the hospital information system and explain the use of materials management system and inbuilt tally interface. Now, let us define what is in hospital information system. Healthcare plays a vital role in society, and people expect efficiency from the healthcare providers and health institutions. This hospital information system will help them to put a solution to a challenge of handling numerous patients that seek their services, which will help them to provide quality healthcare to its patients. Hospital information system was introduced during the 1960s. It is designed to manage healthcare data, which systems that collect, store, manage, and transmit a patient's electronic medical record or EMR. Moreover, it is also a hospital's operation management or a system supporting healthcare policy decisions. Health information systems are used in the different departments of the hospitals. These systems are the nursing information system, physician information system, radiology information system, and pharmacy information system. Now, let us discuss these systems one by one. Starting with the nursing information system. This system is developed to enhance patient care by providing nurses with accurate information to assist them in performing their duties more efficiently. An NAS carries out numerous functions such as handling of personal schedules, which helps the management of the workforce by helping managers to handle overtimes and absences of the nurses. Second is accurate patient charting, which allows the nurses to have better analysis of critical signs and care plans. And lastly, better clinical data integration, which allows the nurses to collect and examine retrieve medical records. Next is the physician information system. These systems are developed to improve the practice of the physicians. Most type of these systems can be used 24/7 to facilitate easier usage of the system by the health professionals to be able to attend to the health needs of its patients. This system can be used in the electronic medical records or EMRs and electronic health records or EHRs. So for example, we have here Dr. Shoshana. He is using a device like for example iPad. So in this iPad, Dr. Shoshana will be able to monitor its patients like its vital signs, the drug taken, and also its treatment plan. So to proceed, next is the radiology information system. It is the core system for electronic management of imaging departments like an X-ray department, MRI department, and other imaging department. So it is used for patient scheduling, resource management, examination performance tracking, reporting, results distribution, and procedure billings. And lastly, we have the Pharmacy Information System. This system monitors the utilization of medicines in health institutions, specifically the pharmacy department. It handles information on medication-related complications and drug allergies of the patients. It is used to maintain the supply and organization of drugs, helps in decreasing medication errors, and lastly, the use in reporting drug usage.
Now we are on the selecting a hospital information system. And now, hospital or any health institution, departments are tasked and responsible to consider aspects of selecting what type of hospital information system should they have or should they acquire. Now, the very first aspect that they should consider is the total cost of package. Yes, acquiring hospital information system is a liability, just like how we connect this to a Netflix account. Netflix accounts have varieties of prices depending on the usage and access to the users. Basic Netflix accounts can only use one device and is limited for only one user only. But even though it is limited, it costs lower if we compare it to a premium account that costs 550 pesos. Now, that is one of the example of considering acquiring hospital information system. So, HIS have varieties of sizes and budgets. So you as an administrative of the hospital, you should consider that the system that you are going to acquire is an affordable system and an effective system. Just like, for example, if you're going to have a maintenance per month of this system, make sure that you consider the financial aspect of your institution. Next aspect that they should consider is the web-based system. When we talk about web-based, it all revolves on the concept of internet. Now, the era of producing hard copies are so long gone. They should consider it as a system that is web-based. Okay? It should be internet accessible system where authorized personnel can access the system anytime and anywhere. Just opening a device and going to that link will make you access all the data. So in here also, web-based system is being accompanied with a strict security. Unless you're a hacker, accessing this system is very difficult. That's why web-based system is accompanied with a strict security because it is being limited to those authorized personnel that can access the data. Third aspect is the implementation and support. This is a very necessary and imperative measurement that the hospital or the administrative should be done. During the deployment of hospital information system or updating this system, they should have an imperative measurement to conduct trainings and assistance to those people who are going to monitor, who are going to use this system. Because it's kind of awkward. And if you're going to look or think of it, a hospital that won't conduct assistance and trainings to their employees who are going to monitor the system, it's kind of, we can call it pabaya, di ba? Just like, kung gusto mo na magpapa-implement ka ng isang rules, make sure that those people who are going to rule out going to overview the rules are much more knowledgeable. So the hospital is responsible to conduct trainings and assistance for their employees or users under the system. And also, 24/7 web service. We are talking about the hospital. There should be no hospital that na magko-close or magsasarado sa isang oras, kahit isang oras lang. They should be open 24/7, all day, all week. So this aspect, the hospital should consider that their system should be available all the time. 24/7 open telephone service and web service. And next,
So for the HIS providers in the Philippines, these are the three: BizBox, KCCI Medsis, and Comlogik. So proceed. So the first one is BizBox. The goal of this company is to improve work efficiency healthcare institutions through software systems, and it was found 25 years ago. So it also has an independent software vendor of the year award for ISP. It has fully integrated systems such as electronic health or EHR and document management system or UMS that will streamline tasks and help services. Proceed. Next is KCI Med, also Kaiser de la Cruz Consulting Incorporated. Specializes in application development for hospitals and industrial clinics in the Philippines. It products visual medcs for hospitals and medsco for schools. These two products provide integrated, comprehensive, and proven solutions for efficient healthcare practices. And the last one is Comlogik, also known as Comlogik Business System Incorporated. Comlogik led the way in developing innovative applications like online hospital services in which patients can access their billings and examinations results, while administrators can access report cards and doctors can access patients' record anytime and anywhere. It was also a Philippine-based software development company that was established in 1999. So to proceed.
HIS function includes help desk, scheduling, patient registration. Proceed. Help desk is intended to provide the clients with the information and guidelines corresponding with the company's products and services without any hassle. In our time, we reached the point where we no longer needed the manual retrieval of information, and without it, that's when the help desk becomes more efficient. Proceed. Scheduling. The managers and employees scheduling software helps save time and makes employee scheduling less difficult. This is where the manager and employees can access their work schedule wherever they are. Proceed. Patient registration. The HIS patient registration records the relevant information concerning the patient. This form is used to keep track of the patient relevant details. This piece of information are used to keep track of records and manage accounts. This form is usually filled out during the patient's visit or consultation, and if the patient is unable to complete the form due to the needs for immediate medical attention, the form can be filled out by a relative or a guardian. Proceed. Oh, I'm done.
Laboratory, radiology, and cardiology reporting. Proceed. Laboratory reporting. An excellent laboratory report does not come with a short list of instructions. You may only have one chance to impress your reader. While poor writing might turn readers off, a well-written laboratory report can have an influence on your reputation, career prospects, and promotion opportunities. You may also draw the attention of the scientific community to your work and retain them as your readers. A laboratory report generally contains many sections such as title, introduction, procedure, result, and discussions. Regardless of the style format, all laboratory report must contain the same items as required by institutional and company policy. Proceed. Radiology reporting.
A radiology report contains complex anatomical and medical terms that are written particularly for healthcare professionals. It is an official medical document that provides the detail of requested radiology examination and the procedure conducted by the radiologist. Findings in the report take into account both positive and negative findings. Basic sections of radiology report are administrative information, patient identification, clinical history, imaging technique, comparison, observation, summary or impression, and signature of the radiologist. Proceed. Cardiology reporting. The medical staff can process laboratory reports and submit them to the physician for approval. This implies that findings are produced more quickly, resulting in a better patient experience. It contains important medical information based on the result of the patient which are set against past medical records. Doctors are able to write vascular reports much faster since access and retrieval information are made more convenient through computer system, and vascular sonography reports are more accurately created.
Now, we will talk about billing, contract management, and package deal designer. Billing. Billing statements show all records containing invoices, payments, and the current balance of a patient's account. Through HIS, outstanding balance and overdue payments are easily checked. Before, there have been numerous problems faced by hospitals in operating the manual system of billing, which is not very efficient. A lot of paperwork has been done, and irrespective of the number of patients, take a long period of time to prepare. Through the use of HIS, it ensures that the number of patients being attended to on a daily basis is known or tracked down, as well as accounting for bills of the patient. HIS helps to make the billing process faster and error-free. Next would be the contract management. Contract management is the process of managing contract creation, execution, and analysis to maximize the operational and financial performance of an organization while reducing financial risk. Contract management proves to be a very time consuming element of business, which facilitates the need for an effective and automated contract management system. So, when this contract management system is properly implemented, organizations can now expect the following. First would be realization of expected business benefits and financial return, cooperation and responsiveness of the supplier to the organization needs, no contract disputes or surprises, satisfactory delivery of services to both parties. And now we will move on to the package deal designer. Posting diagnostic medical packages for inpatients and emergencies requires the same process. The difference is that for emergencies, this is called post-diagnostic package deal. Through the help of HIS, we are now able to avoid the hassle of paperwork when it comes to accessing information regarding the package deal.
So now we are in admission, discharge, and transfer procedures. So first, let's discuss about the admission. So admission is asking permission to enter a place. And admitting in a hospital, the patient or his family has to call the hospital beforehand. Upon calling the hospital, the admission counselor will ask questions, preliminary questions such as the patient's name, age, sex, address, and of course, his medical history. A doctor, the primary care doctor of the hospital, or a specialist will determine whether the patient has a medical problem serious enough to guarantee or to warrant admission to the hospital. So, when the specialist or the doctor approves of the admission of the patient's doctor will now schedule tests and exams to know more about the patient's condition. So of course, with the help of HIS, the admission process will be more effective because just like what we talked about before, HIS ensures the safety of the gathered data, and the data gathering procedure is less hassle and more systematic. And to add, the test the test that will be conducted depends on the patient's condition and of course the decision of the physician. So, so here are um, some examples of admission procedure in HIS. I think it's from Beesbox. Sorry for that. So to proceed, so discharge. Discharge is the opposite of the admission. If the attending physician sees some improvement in the health of the patient, or if the patient's condition is no longer threatening and his life is now out of danger, he will now be approved to be discharged. Note that only the attending physician can discharge a patient. Without the physician's order, the patient has to stay in the hospital and receive treatment until he gets better. In discharging, in discharging a patient, of course, there will be a plan called a discharge planning. Upon the approval of the attending physician, the nurse in charge, the family, and the patient itself has to prepare. The doctor and the nurse will explain the patient's condition. They will explain thoroughly the test results of the patient, what food that he has to avoid, and what food that he has to intake. Of course, the patient's medication is also discussed. The doctor has to make sure that the patient understands the importance of taking his medicine on time. It also involves the schedule for follow-up checkups. If a patient, such as a patient that suffered from stroke, they are advised to take physical tests, which is also part of the services offered by the hospital. The doctor will offer this treatment because the doctor has to ensure the recovery of his patient. To transfer, it is when a patient will be moved, um, be from the hospital to the other hospital or from one section to another section. Like if a patient gave birth, of course, she will be on the delivery room. After she delivered the baby, the mother will be moved by her own room for her to rest and to recover. And the baby will be moved in the neonatal care unit. So there is a movement of the patient right from delivery room to the private room or to the neonatal care unit. So from one section to another section. Of course, transfer from one hospital to another hospital also happens. So it is when the first hospital does not offer the needed treatment of the patient. So the hospital have to call another hospital to cater the need of the patient. So there are some like there, but it does not cover the movement of the following. The movement of the lifeless or the expired patient because only his or her family have the right to move the deceased. And of course, patients who don't have the permission of any authorized personnel. Same goes with in discharging patients and in transferring patients, the physician has the say whether the patient will be transferred or will be discharged. Without the physician's order, without his signature, the patient will stay on the hospital. So the next one will be materials management system, pharmacy, main stores, and purchase.
So materials management system, pharmacy, main stores, and purchase is primarily concerned with planning, identifying, purchasing, storing, receiving, and distributing materials. So, in other words, materials management system, pharmacy main stores and purchase. Its purpose is to guarantee that the right and sufficient materials are in the right location when needed. To proceed with management reporting, a platform for reporting and controlling information valuable to the institution. It enhances the capability of an institution to be more responsive, efficient, and effective in decision making. So its purpose is to stabilize the information in the to the institution and to control the resources. So proceed.
And now we are on our last slide of this reporting. I hope that you are still following what we have been discussing all throughout. So right now, we are now tackling about inbuilt tally interface. One of the most and best example rather of inbuilt tally interface is Tally ERP9. Tally ERP9 is a very famous software that provides simplified solutions to operations. This Tally ERP9 also provides exceptional capabilities to simplify critical aspects of the health institutions regarding with registrations, accounting, inventory management, and tax management. In registration operation, as what you can see in our book, as you open your book at page 101, figure 9.8, we can see a format, an example format of registration form under Tally ERP9 software. So there it is written your name, the basic demographic data of the patient, like the guardian, it's his or her location. Next is the accounting. In the accounting operation, we can say that it provides simple to use accounting features that enable you to record hospital transactions easily. So in here, the Tally ERP9 provides accounting books that the users or the nurse, the financial employee are already going to compute, input transactions under these accounting books. Next is the inventory management. Inventory management, it has menu list of the masters like stock groups, stock items, units of measures of the hospital, which you can create, alter, and display the inventory master details. So dito po napapalagay yung mga na purchase na hospital na medicines, equipments, and such. Next is the tax management. This we can say is a very complex aspect of the hospital, but in Tally ERP9, it made the transaction and the input of transaction much more easier and convenient. So that's the end of the reporting, and I hope you have learned something. Thank you for listening, and may you have a blessed day.